Hey, everybody. I am Tanya Osborne, Director of Events and Community Engagement with Women Grow. Welcome to today's virtual panel. Today, I am Gia, just the Tanya version. And I'm so excited to have this conversation. Gia is actually out of town doing magic that Gia does. So I have the honor of leading this panel discussion. And I'm so excited to do it because actually all of the people here I know well, and I know how literally these are like trailblazers of the industry. So we're lucky to have this conversation. Today we are having a conversation about moms and cannabis and puppies. No, see the puppies. But really, because it is Mother's Day Mother's Month. I think Mother's Day is every day. But we always want to have conversations that are thought-provoking, that we really just want to engage. And we want to talk about health and wellness today and how important health and wellness is and how cannabis can be an aid, and how to kind of approach that topic, because we as moms tend to also, in addition to dealing with, just parenting and what's happening in the world right now and homeschooling or remote learning, we also trying to keep ourselves together and maintain our own health. So I have the awesome pleasure of bringing up, hold on, let me get everybody on the screen. Today we have Dr. Stacia Woodcock, who is the dispensary manager for Curaleaf in New York. We have Dr. Junella Chin, who is an integrative medical professional. Also, you kind of bi-coastal between New York and California. And Tianna Smith, who is a former Women Grow market leader, advocate, patient, mom, and the owner and founder of the Hemp House in Atlanta. So, ladies, please, I want to just have everyone kind of introduce themselves. I really am curious about, what brought you to cannabis? And that's really what I would want to know, because it's really weird how people end up in this industry. It's kind of like by default, by necessity, you kind of just found it and you stayed here. And I'm curious. So first, let's start with Dr. Stacia. Please introduce yourself.
Hi, everybody. Thank you so much for having me. It's always such a pleasure to partner with Women Grow, and Tanya, obviously. I love the message you're sending, and today's topic is near and dear to my heart. I'm a clinical pharmacist. My background is in retail and specialty pharmacy, and in particular, fertility and women's health was my area of specialty. If you would ask me in pharmacy school if I would ever be in cannabis, I would have laughed in your face, because I completely bought into the stigma that medical cannabis was just a way for people to get a card and smoke weed. I didn't really understand the actual medicinal benefits, the body chemistry. I didn't know anything about it. And a former colleague of mine approached me. He was the director of operations for Curaleaf. And he's like, listen, we really need somebody that can help advocate for the program, educate practitioners. And you're so good at that. Like, would you be interested in doing that for Curaleaf? And I was like, well, I don't know if this is legit. So I came down to New York and I spent the day in a dispensary. And I tell this story all the time, but I was in the dispensary and this gentleman walks in with a cane and the whole staff starts clapping and cheering. And I'm like, what is going on with this guy? And they're like, a month ago, he was in a wheelchair. And I'm like, what? And you think those things are the exception, but in cannabis, they're the rule. And right there, I was hooked. I'm like, wow, if this is happening, I need to be part of this. And ever since, these sort of things are what I see in the dispensary. It's what I hear from patients, from doctors. It's a miracle medication for so many people that are at their last leg. They haven't found any hope. And for women in particular, who so often are told that our conditions are in our head and we're given antidepressants and told to just go deal with it or go to therapy. And we found so many of those things that, we've been told that are tied to the endocannabinoid system. They're tied to cannabis as a therapy. And so now I'm all in, clearly. huge advocate for cannabis and particularly for women's health.
Thank you so much, Stacia. Dr. June, please introduce yourself. Oh, hold on. Okay, let me unmute you. Hold on. There you go. You're all set.
Hi, thank you so much to Women Grow and the Canna Diva for including me today in this segment. I have worked with you guys for a long time and with Dr. Woodcock, and I don't know Tatiana, but I'm super excited to be here today, especially talking about women's health, because I was a cannabis patient before I even became a physician. When I was in medical school, even before I even officially became a doctor, I was already a cannabis patient. I'm a chronic pain survivor and in medical school in San Francisco. So this is over 20 years ago. One of my attendings, one of my mentors offered me medical cannabis for my chronic pain. And that changed my life completely. I probably would not have become a physician if it wasn't for cannabis. And now I practice on the East Coast in Connecticut and in New York. I do telehealth across the country, across the world. And I help patients integrate medical cannabis safely in the context of other prescription medications. I work with other specialists. I'm an educator. I'm an entrepreneur. So I think this is a perfect opportunity to talk about women's health, because 1 in 7 women are on some sort of prescription medication, usually antidepressant, and most women downplay their pain, and they're offered an antidepressant as a first-line choice before even addressing their chronic pain by their providers.
That is a fact. That is a fact. Thank you so much, Dr. June. Tianna, please introduce yourself.
So hello, ladies. Thank you so much, Tanya, for the invitation. It's always great to connect with Women Grow again. You all are family, and then as well as sharing the stage with Dr. Stacia and Dr. June. My name is Tianna Smith. I am a mother of 3 and a wife of 1 husband. Just figured I put it out there like that. So I'm gonna have more than that, and I don't know how, because everyone is enough, right? So I have 3 young children, 12, 10, and 8, and I guess I kind of came into the cannabis space. I'm always telling my story about how I had a rare brain condition called Chiari malformation. I had brain surgery in 2018, and the medications that that I was taking for my migraines or like anything. I also suffer from gastroparesis, so a lot of things that were going on with me health-wise, the traditional medications just weren't working for me. For me, period. So I turned to cannabis. However, my husband and I have had a conversation over the past couple of months, and we're like, let's be a little bit more transparent here that cannabis came a little bit before that, right? It helped keep us married. We tell people that all the time because it lessened my anxiety as a wife and as a mother. So before I became pretty sick, it was still in my life. It wasn't until I started really getting into my own diagnosis that I understood the medicinal impacts of it. So fast forward to 2018, when I had to be out on disability, I became a huge advocate out here in Georgia. I started a nonprofit, Normal Women of Georgia, and that's when the whole Hemp House idea came into play. We are still, 3 years later, and we are still really trying to get ourselves off the ground. And it's okay, because last year, as a mom, I decided to run for state senator. We're going to free the plant, and there's so many other issues that I really wanted to, show that I was passionate about. So a lot of things kind of took a back, were sat on the back burner. So, through the year, things have kind of adjusted, and I am just trying to heal. I recently had surgery in March, so I am focused on healing. I am focused on family and focused on spreading the gospel of cannabis. Really, it's such an amazing plant, and I love to be able to talk about this with everyone today. So thank you.
Thank you. Thank you so much. So I wanted to just jump in from the VIN. I just want to get my questions out. Hold on. So we're all like, it's hard to, we all have experience with cannabis. We all, know what it is, how it works for most people or for ourselves. I personally was using cannabis not knowing I was using it medicinally, because I've had anxiety since I was 13 years old. And then a doctor that I had, a really like left thinking doctor, she said to me just these words: "Oh, you're self-medicating." And honestly, that language changed my life, because my family had pretty much made me feel that that wasn't the best course and I was going to be out on the street. You know what I mean? It's like, you're going to smoke a joint and then you're going to be on the curb doing God knows what with God knows who, And hearing that language from a medical professional literally changed my life and how I view the plant and how I view my relationship with it. But from a person who is not when do you feel women make the decision to use cannabis instead of traditional medication? In your experiences, let's start with Dr. June. At what point do women say it's okay for them?
Usually when I see patients and they're using plant-based medicine, it's because they've decided to take control of their own health. They've really decided, every time I go to the physician, I maybe get seen for 7 minutes, and it's always another prescription. It's always another prescription. I said, "Oh, don't you remember that prescription you gave me 2 years ago? It didn't work." And they stumble upon it, usually through a friend or a colleague. And that is when they said, "You know what? This makes me feel better than anything I've ever tried in conventional medicine, or even combined with conventional medicine. This makes me feel better. And it's about time that I take control."
Let me see. Okay. Unmuted. Am I muted? Okay. Let's have the same question with Dr. Stacia. When do you see women come into Curaleaf when they've, instead of using traditional medicine, they decide to use cannabis?
So I think there are two pretty distinct groups that I see. The first is the women who are already pretty self-empowered, already looking for holistic, natural treatment modalities. They're not interested in prescription drugs. And, like Dr. Chin said, they really are taking control. They want a holistic path. So they come with intention, right? The other half, and it's the half that I enjoy counseling the most, are the ones that have tried everything else because they're terrified. They want nothing to do with cannabis. They don't want to use drugs. They think it's the devil weed. And someone finally has told them they should try it. And they're like, well, I've tried everything else. What do I have to lose? Because now I'm at the end of my rope. And those women, for when I'm able to explain to them why nothing else has worked, how cannabis can work when other things can't, and why, to see their eyes open and see their hope is so impactful. And they're always just like, this is not what I expected. And I'm like, I know. And that's what's so great about it. So those are the two groups that I see most often.
And Tianna, when you decided was your cannabis consumption before, did you realize that it was attached to your anxiety? Or for me, I didn't. Yeah. I was just like, it's college. I'm in college. You know what I mean?
Yeah, I mean, I didn't consume too much in college at all. It was really after like I had a family or whatever, but I wasn't really thinking, at that point I knew about medicinal cannabis, but I wasn't really thinking medicinal on the level of anything past anxiety, But I realized, I was on anxiety medication. I was also on nerve medication that made me hallucinate, having these crazy dreams. And honestly, I just felt like a horrible ass mom. Like I really did. Like I was irritated all the time. I was tired all the time. It was just too much for me. And it was a very personal decision. Like Dr. June and Dr. Stacia said, it was just like, I'm tired of it. Like, there has to be another way. And I know that there's another way. So if you know better, why not do better? Pretty much.
Absolutely. And so I always bring everything back to stigma because, as Dr. Stacia said, people are like, it's the devil's lettuce. I don't want to touch it. I'm always curious about the people that you meet, because I know from the community that we work with, at times they want it, but they're afraid of the perception in their community. They're afraid of, I'm going to tell my child to not, be a consumer, and I am. And how do they overcome that? I feel that it's simple education. But what experiences have you had with people just really wanting to, but battling cultural, personal, family, and household issues? Dr. Stacia?
Yeah, I think it's so ridiculous that in our society, we're fine having a glass of wine that holds a whole bottle and calling it mommy juice, and there's no stigma associated with that. And yet someone that uses cannabis is a bad mom, right? Like, stigma is just so funny that way. And it's always astounding to me because I would much rather have a cannabis mom than a drunk mom. You know what I mean? Like, and obviously you can use alcohol responsibly too. So I'm, exaggerating for effect, but I think that stigma, it's just really interesting to me, the way that one can be glorified and one can be so negatively stigmatized, in the same way. And I think what's really interesting now is, as we're seeing more sort of regulated programs, more states come on board with medical and adult use dispensaries, it's really the younger generation that's pushing the older generation that's afraid to try these things. So like every day I have, it's like my nephew or my granddaughter that's bringing someone in that has been so stigmatized against cannabis, or they'll bring a gummy to grandma and say, try this. Like, you're in so much pain. I feel like this might help you. And then they're afraid to tell me. They're like, well, I tried this guy. I'm like, dude, this is a safe space. Just tell me what you've been using. Like, let me help you. And so that's been really fascinating to see. So it feels like all of this work that we're doing to educate or re-educate is starting to take effect and making a change. But I think especially for moms, there's a real stigma. And, I think that I always, as women, I teach empowerment. I'm like, look, like, if you want this, talk to your primary care doctor about it. Don't just automatically go to, outside of your normal care. Like, right? You need to advocate for yourself. You need to normalize it. You need to talk to your family, educate your family about what you're using and how you're using it, because that's the only way we're going to decrease the stigma is if we start taking ownership as patients. Or as consumers, right? That we're using this and why.
Absolutely. And Dr. June, what do you see as far as women trying to overcome the stigma attached to using cannabis as medicine?
For me, the biggest thing that I see from especially mothers is they don't want to be looked at as an irresponsible mom. Right? I have an 11-year-old and a 12-year-old, and cannabis is very normalized in our family. We talk about it as medicine, and we talk about responsibility and using it. But if you come from a culture, from a background where there isn't a lot of communication among family members, a lot of mom patients that come to me will say, I know my parents will think that I'm a bad mom, or even my partner, my spouse will think that I'm just getting high all the time, and that I'm not taking care of the nuclear family.
Right.
So getting rid of that stigma is very, very important. But they'll be okay.
And that's
they'll
work.
be okay if you're on Xanax or Klonopin. Or
I was just about to say that. I was literally just about to say that. It's such a weird vantage point to see that and you need a recommendation for medical cannabis in New York State. I mean, I'm sure in most states you do. So it's like you have a prescription, but I mean, I know it's not. And I know that it's very easy to take, oh, I'm taking this, or I'm taking an opiate or whatever. And no one looks at anyone differently than, I've watched TV shows where like Dr. Stacia said, the woman has a bottle of wine holding it, no glass, holding it to her head. And it's a funny joke. It's ha ha ha. And if a woman's rolling up, everyone's like, what is she doing? I cannot believe it. And it is a stigma that I think we all as professionals in this space really work hard to overcome, you know? Tianna, in Atlanta, your medical program is interesting, if I'm not mistaken.
That's very good word.
So how is your medical program in Atlanta?
So our medical program is low THC oil, 5%-ish. So a very high-end hemp oil. No offense to anyone. I just know for myself as a patient and other patients that I know personally, you know, we, depending on pain relief, depending on what you're actually using it for, that may not cut it. So we are still in the process of, you know, awarding, I guess, well, licenses or whatever for the dispensaries out here. So that has always been the issue. You know, great, you have a low medical THC card. Where do you access it? And that was a question that one of the congressmen asked me, and he was like, so how do you get it? And I had to tell him, I'm like, do you want people like myself, like mothers, to feel that way? You know what I mean? Like that we have to do something that can be an issue so that we can live or survive and not be in pain. Because, you know, it's not just about the children who suffer as well, but other people. And then what about those who are not even medical patients? So we have to kind of look at everyone. So yeah, it's tough.
Yes, because you have a medical program with no dispensaries. Is that accurate?
I mean, sure.
Yeah. So, and I always say the stigma is in legislation.
Yeah. Oh, yeah.
So the stigma is real and it is deep.
Yeah.
Because it is in the legislation. And so that's why advocates like all of us are so important, you know?
And I, just to add to that, and
yeah.
obviously I'm in the industry, so maybe should be a little careful of saying this, but I think there's also a stigma in the way that we talk about dispensaries. Like why, and I get that it's a regulatory program thing, but why do we call one medical and one adult use? Like why are we assuming that people that go to an adult use dispensary don't have medical needs, right? I think that, like we've already indicated, most people that are using recreationally are really self-medicating, right? Like it's very rare, you know, stress relief is still medicine. It's still medical use. And so I think, you know, even the industry itself has some room to improve when it comes to getting rid of these stigmatized words and classifications of consumers.
Yeah, it's
100% right. I am not qualifying of a medical card for my state.
Right.
I'm a caregiver in my state, but I don't qualify for a medical card. Right. And when we have adult use, but when we are actually open for business for adult use, I'm looking forward to that. I'm really, really looking forward to that, as I'm sure a lot of people are, really, just because now you have a regulated place to go, but it is medicinal for me, just because I don't qualify under the current medical program. So we do have to think about that. It really is a big, big deal, you know? Okay, so my statement here is overall wellness takes many forms, from mental health. I know I have thyroid disease, so endocrine health, reproductive health. What are the most common health issues that you see that for women that are seeking medical cannabis? And I'll start with Dr. Stacia.
So lately, anxiety, I think, and that's not a qualifying condition in New York. So a lot of patients have to qualify under a different condition, and then they just tell me, you know, that it's anxiety that they need help with, particularly with COVID-19, with trying to be a mom and work and do everything at home, all in the same space. I think that's been really stressful. And so that's been a huge one. pain always, and in particular, a lot of fibromyalgia patients. And I think that's always fascinating because they've tied that to sort of disorders of the endocannabinoid system. And a lot of the fibromyalgia patients are on 6 or 7 pharmaceutical medications, and it's just so much. And they come in and I can get them off of most of them, if not all of them, and just on cannabis. So I see a lot of those patients as well. I think once the qualifying conditions open up in New York, we'll start to see a much wider spectrum. But right now, those are probably the 2 that I see most often.
And Dr. June?
I would say, yes, I echo those, but what I've been really seeing a lot more in the last year and a half during the pandemic is irritable bowel as well as pelvic pain. So, irritable bowel and pelvic pain go hand in hand. I think with, decreasing the availability of, running out to the grocery store and eating, better foods, maybe you're just, maybe just eating too much at home. That has a toll on a lot of my irritable bowel patients. And pelvic pains have been actually a big thing. You might be a little more sexually active and you already have some sort of irritable bowel pelvic pain and it gets a little bit worse. During the pandemic, people are having lots of sex. People are masturbating more. So that pelvic pain, I'm seeing a lot. And
Wow.
help with pelvic pain.
That is amazing. I live by myself with my 14-year-old, so clearly that's not my issue. But, wow. Okay. So we had a conversation earlier about medical program and having conversations with your doctor. So with all the health issues, and we didn't really talk about, in detail the conditions, but we talked about aligning with your doctor and being open with your physician. Now, some folks don't have the awesome physicians that we have here today. And some of the recommending physicians that I've met, not Dr. June, really just you give them your documentations that support your qualifying condition. They write you the prescription, and then they send you to Stacia, and then you're on your own, and I think it makes sense to work in tandem with your primary care physician so that they understand. But since so many doctors are unknowledgeable, or they have their own stigmas, how does a patient overcome that? Like, I want to talk to Tianna first, because I'm curious, when you told your physician that you were going to use cannabis to aid in your treatment, how was that received?
So I remember when I first was diagnosed with gastroparesis, and I was telling my GI doctor, this was 2014, I use cannabis for nausea. And he was like, that's why you have all these issues. I'm like, wait a minute. And, that was the first time that I heard about that cyclic vomiting syndrome about cannabis. And I'm like, but it's not how it's happening. Like, you need to hear me out. And it really angered me, you know what I mean? Because I knew that I had done the research, not even on Google. I lived it. I experienced it. So from that point on, I let them know, well, I take cannabis for this, for that. And I mean, I've had some doctors that are like, okay, but most of them are like, continue doing it, like, I can't help you, but continue doing what's working for you. And I have had a nerve doctor, or my pain management doctor back a few years ago, that was like, I wish that I could prescribe like medical cannabis instead of the opioids or whatever that I'm prescribing, because I wouldn't have that issue. So, I mean, I'm the friend that is like, hey, have you tried marijuana? That sends to Dr. June, that goes to Stacia, stuff like that.
So, Dr. June, what would you tell a person who wants to have open dialogue with their medical doctor, their primary care doctor, and their primary care doctor may not be accepting or knowledgeable in order to make that, to work with you?
It's really tricky because from the other side, as a physician, I see it I see colleagues that will diagnose the patient with cannabis use disorder on the chart if you say I've used cannabis. So, for I think for women, especially mothers, your intuition goes a long, long way. And physicians oftentimes will downplay that. Instead of really, advocating for you, they usually say it's in your head. So if you have an old school doctor and you already know that old school doctor is just not going to go for it and it could taint your relationship, that's a really tricky position to be in, right? Because there you are, you're saying, you're admitting to something that doctor may never understand, and there will be a stigma. What I offer my patients is, let me talk to your physician. Why don't I bridge the gap, talk their language, show them some journal articles, and just open up the conversation for you? And there are tons of nurse practitioners, nurses, health advocates that can do that as well. And, and I understand some doctors that will just write a card and send you on your way to Curaleaf or another dispensary. And I think that's okay too, because if you're going to help the patient get the recommendation, great. At least they've gotten that far. And a lot of these dispensaries, especially, it's Dr. Stacia, Curaleaf, they're an extension of health and wellness.
Yes.
And there are plenty of health coaches and advocates and naturopathic physicians, even your acupuncturist or your massage therapist, social worker. We're all part of the same team in helping you get better health. So we have to, I think, take the physician off the pedestal and look at this community that you have access to.
Yes, that's so huge, Dr. June. Thank you. So, Stacia, when they get to you and they don't know anything and their doctor doesn't know a whole lot more other than that, are you doing that work too, where you're being that bridge or?
Oh, yeah, absolutely. I mean, we are so fortunate in New York that pharmacists are required in our dispensaries, right? So that's not common. There are only like 5 states where that is mandated. So I think in New York in particular, a lot of those doctors who are willing to just write the certification and send the patient on their way, they do that because they know that there's a clinician in the dispensary that is an expert that can really guide the patient properly. I think there would be a lot more reticence or nervousness if you're just sending them to a non-clinical dispensary where they may or may not get the correct information. Right. I would love to see cannabis medicine be like any other specialty, right? Like if you have nerve pain, go to a neurologist. If you have cancer, you go to an oncologist. And if you want cannabis, you go to Dr. Chin. You know what I mean? A cannabinologist. It is a specialty. It takes a lot of work and a lot of reading, and not even just reading, but like parsing and deep diving into journal articles to really understand cannabis medicine. It's not easy. And there are some experts who do it amazingly well. And those are the ones that I think patients should be using for their care. But I do still think, you shouldn't be hiding things from your primary care physician. And I think that too often as women, we stay silent and we accept subpar medical care that doesn't meet our needs because we're afraid of what might happen if we speak up. And I completely understand, like, especially in the North Country of New York, where there are 2 primary care physicians for an entire county, your options are very limited. So I do get that. But if you're in an area where you have options, then you need to like interview your doctor just like you would any other person that you were going to hire to take care of your house or your kids or your car, right? Like your body, this is your body. So you need to make sure you're in alignment. You need to say, in your initial physical assessment, okay, how do you feel about natural medicine? How do you feel about cannabis? How do you feel about, lifestyle modifications versus prescription drugs? Like you should be asking all of those questions and doing your due diligence because you need your practitioner to meet your needs. Like you're hiring them, you are paying them, not the other way around. And I think that often we forget that and we think we just have to sit there and take the 8 prescriptions that they give us. You know what I mean? And we're like, okay, I guess this is what I need to do. And we don't ask questions. We don't say, explain the lab to me, explain the pill to me. Is there something I can change in my diet or my lifestyle instead of this medication? Right. And so that's the advocacy I would like to see. I would like to see more conversations and more, self motivation in order to get the care that we want and we deserve.
It's so funny because that was perfect. As women, we tend to advocate for everyone else. I will literally fight a kid to defend my child. Like if he's 14, I'm 14 today, you know, like that kind of situation where you advocate. My mom passed last year. For 5 years, I was her health advocate. That's what I did, you know. I make sure that my household is in order. But at times, until this doctor, and she was a little crunchy, so I felt comfortable talking to her. I'd never felt comfortable talking to doctors about my consumption. And you're right, that is not great. And now in New York City, for me, there's a primary care doctor all everywhere, you know, so those conversations should be had. You know, maybe we need to write a little checklist for people to are you okay with, because honestly, if they don't have that information, as Dr. June said, there's things that are published, journals or doctors speak, you know, that they can have access to, you know, and there's really no excuse in 2021 to not at least know more or be able to do better with cannabis medicine. Am I pushing that?
Yeah, I mean, every doctor's office that I go to, because they always ask what you do. And so I tell them, like, I don't just say I'm a pharmacist. I'm like, I am a medical cannabis pharmacist. And they're like, oh, and so it's either like, or it's like, you know, I think one of our doctors does something with that. Like, tell me more. And every single office that I go to, I've done an in-service for at this point, because that conversation leads to, oh, I didn't know that. Oh, you should come talk to us. Oh, we should educate our staff. And now they're all certified. So education, outreach, and like Dr. Chin said, it's about the collaborative care. It's about all of us working together to uplift and support one another. So if you as a patient aren't comfortable, reach out to the clinicians like us who are willing to advocate on your behalf, because I'm more than happy to, you know, load up with some stuff and go to your doctor's office and say, hey guys, let's have a conversation, because clearly you're, you know, undereducated and ignorant about this, and I'm happy to give you some information. So, you know, don't be afraid to reach out and use the resources that you have. There are so many of us. I mean, I'm sure Women Grow has so many of us that can help support and have a movement towards more accepted use of cannabis in medicine.
Yeah, someone put in the post in the comments, self-advocacy. And we tend to advocate for everybody else, you know, and we do really need to advocate for our own health. I mean, because honestly, I was not going to dispensary to get my medicine. I was going into legacy market, you know, to get my medicine. And we should still have those conversations. It doesn't really matter, you know, we have to have those conversations just because it does affect our health, you know. So now the person comes into dispensary, they've gotten a recommendation from a great doctor like Dr. Chin. They know what they're coming in for or what they want to have accomplished. Are people still, is there an entry point? Like, are people starting with CBD and maybe microdosing up? Would you treat a person who's never had any cannabis before? And that would go to Dr. Stacia.
So unfortunately, there's not like a hard and fast answer for that, because it depends on so many different factors, right? It depends on the patient's symptoms. It depends on the other medication that they're taking, and it depends on their lifestyle. Like, I'm not going to approach treatment for a mom with 6 kids who has to be like working and present and doing a bunch of stuff all day the same way I would someone on disability who's at home and, you know, pretty much in their own space all day. Like, it's very different. And, you know, symptoms, previous cannabis experience, what their level of tolerance is, what their experience with the plant is, all of that is going to influence where you start and how you treat. And so that's my best answer for that. I will say, you know, it's kind of interesting that most people, they've used cannabis recreationally at some point in their life and often had a negative experience of like, oh, I tried it once in college and I hated it. And then they're like, so then I bought this hemp CBD and it didn't really do anything. And so they don't realize there's this whole middle that they don't know anything about. And so that's where, you know, that's what we're looking at. But, you know, there are often times, you know, if there's someone who gets drug tested for their job and they know they cannot test positive for THC, then we have to use, a CBD isolate in order to help them and find dosing that works. So there's just a lot of factors that come into play there, I think. And Dr. Chin, I'm sure you can talk about dosing until the cows come home as well.
Yes, Dr. Chin, what's your input there? Like a non-cannabis user coming to cannabis, or even someone who's not a daily or more often consumer, someone's not maybe a social consumer, but needs to now use it as medicine. Is there, I know there's no one size fits all, unlike traditional medication, which is like, here's a script, have at it. I know cannabis is different, and that's really what I love about it. But what is your experience with the new patient?
So I always make sure that I look in the context, of a full medical practice. So I look at their other medications. Many of my patients are on antidepressants, anti-anxiety medications. So sometimes with cannabis, if you consume too much, or the different types, too much THC, maybe it can get in the way of your serotonin receptors, and it get in the way of some of your other medications. So I do make sure I address that. And I always, again, start patients with a very, very low dose. And it's interesting that you said that about prescription medications, because women actually metabolize prescription medications much more differently than males because of our adipose tissue, the amount of fat that we have in our hormones. So we actually should be dosed differently when it comes to prescriptions too. Your typical Z-Pak or your typical antibiotic actually should be a different dose for a male and female. So with the cannabis plant, it's nothing different. I always say this is like your high blood pressure medication or your diabetes medication. We're going to experiment a little bit and we'll recheck and see if you get better or if you get worse. I mean, you do the same thing when it comes to BP meds. So we're going to do the same thing here.
I agree 100%. Thank you. Thank you.
Cannabis is no different. The interaction with cannabinoids and estrogen, women are actually much more sensitive to THC. We're at greater risk for cannabis use disorder if we use too much THC. And so all of those things matter.
Yep.
So someone had a question in the comments about, I wanted to find it. I lost it, but it was a good one. Oh, there it is. What about stroke patients? Do you think it's wise to use cannabis when there are stroke medications or when on different medications? Thank you, Danny.
So patients that are blood thinner, I always make sure to check with their hematologist and oncologist to make sure they're checking their INR levels, their bleeding times. And then with stroke victims, I always want to make sure, is this patient a fall precaution, right? Does he or she live alone? If that's the case and you're taking cannabis at night and you're going to the bathroom, are you going to fall? Especially, or even during the day, do you have a home health aide nurse with you? Do you have a spouse? Do you have are you living with your children? So that risk, I make sure to get off the bat, and then making sure that they're getting regulated, cannabis. They're not getting it from their grandson, who's bringing it home to grandma, and we don't know what's in it, and making sure it's not too strong.
Absolutely, that makes a lot of sense. And then there was another one. Has anyone associated this cannabis use disorder with bad product? Now we're talking medical cannabis, so these are regulated products, but have you seen cannabis use disorder? Believe it or not, I didn't know that was a thing.
Yeah, I remember mentioning that earlier. Like, was it you, Dr. Stacia, the cannabis use disorder? I've heard of it before. Thank God I've never been diagnosed with it or whatever. But when I think of it, and please, from a medicinal side, correct me if I'm wrong, I'm thinking, just like we've all said, that medical cannabis or just cannabis in general is like directed for that particular person. So if I'm already like high strung, high anxiety type person, and I'm taking something with a cannabinoid, whatever, that's giving me even more anxiety, that's going to be a huge problem, not knowing what I'm taking, not being able to have this conversation with the doctor. And that's one of the reasons why I tell my doctors, what it is that I am consuming. So if there are any type of medications that I am taking as a patient, I need to know how it's going to interact. And half the time they may not know, but at least, it could raise a red flag, and I can go and ask a doctor like Dr. June or Dr. Stacia.
So, Dr. Stacia, what has been your experience with cannabis use disorder?
So, I mean, it's a tricky topic, I think, because the way that the phrasing is for cannabis use disorder, all medical patients would qualify because they're using it daily, right? And so obviously there's some work that needs to be done. But there is a small percentage of the population that can form an addiction that interferes with their ability to live their daily life, drug seeking behaviors, that they're not exhibiting normal social behavior. These are all things that we get concerned with. Typically it's high THC products. And it's a tough question when you talk about bad products, because a lot of times, we don't know what patients have been using, or they get diagnosed with cannabis use disorder without really understanding what they've been using. And there are patients that get diagnosed with cannabis use disorder that are using it medically, and their clinician just doesn't really know what they're doing. And they get sent to rehab, because CPS found out that they were smoking cannabis, and now they're in drug treatment, right? So just because you have a diagnosis doesn't mean it's definitive. It just means that, there might be some miseducation, but there are patients who do, especially if they have compulsive use disorders, that cannabis can be a problem, just like any medication that creates euphoria. If you're constantly chasing that euphoria and it interferes with your ability to live normally, that's a problem.
Yes.
And I think, typically, that can happen when you're not using regulated product and when you're not using product properly, with good clinical guidance and with a good understanding of why you're using what you're using. That's more of the concern that I see. But most medical patients, they have good guidance. They're using it for the right reasons, and they're using it properly, and it's regulated product. So it's not something that we really see very often.
That's why I can't wait for adult use. So that we have regulated product in the state for both sides, for medical patients and for adult use patients. I'm so excited about that. So I don't want to, beat a dead horse, but is cannabis use disorder just someone who uses a lot of cannabis? Is that what it is, Dr. June?
No, it's like Stacia said, it's the overuse of cannabis so that it gets in the way of your daily functioning. So it gets in the way of work. It gets in the way of family life. It gets in the way of your academics. It gets in the way of you socializing. So you're actually compensating by trying to overuse the cannabis, but it actually takes you away from productivity and living a quality of life.
Understood.
Like you're not paying your bills because you need that money to buy cannabis, right?
Oh no, well, that's a problem.
Exactly.
That's a whole problem. Yeah. Yes. Okay. Because I know that Tianna has an experience with it, but it was a doctor who really was not knowledgeable that made that call for her. That was clearly not her issue.
And I think he was talking about the cyclic vomiting syndrome, the cannabis, which is a completely different thing, which is a real thing, but yeah.
Okay. Wow. So we know so much. I'm not a doctor, and I would never go to that many years of school, but it's so great to know people. It's not like what you know, it's who you know, right?
But it's also important when you have a cannabis use disorder on your chart, that chart follows you.
Yeah.
And it affects how other practitioners that you see in the future treat you.
Yeah.
And so you should actually get your medical chart and clean it up like you would your credit report.
Wow.
Can you do that?
Mm-hmm.
Especially with medications, right? Don't they ask you, are you doing it? No, actually, I've never. Yeah.
Yep.
Wow. Okay. Let's talk about self-advocacy. You really need to do all of that, right? Well, that's something I did not know. Okay. So we are now coming out, depending on who you ask, from a global pandemic. And I'm not ready to go outside, but I know everybody else is, But I know that cannabis became like a superstar for a lot of people. It became essential in New York State. How did COVID affect patients? And what do you think on the come up do you think cannabis will still be the shining star that it has been for a lot of folks?
I have tripled my amount of cannabis patients that have seen me this year. I had to turn away patients because I just didn't have the capability of seeing everyone. I think that the telehealth component really helped normalize cannabis because I was able to Zoom in with other family members and the other MDs at the same time.
Wow, that's great. That's a gift.
The cannabis industry didn't stop. I think if anything, we got, like, as a collective, got even more creative with how we can do our business, and people from the business side, right? And I'm sure cannabis use went up like sky high last year. People were home, like,
Consumption, 21 and older consumption was through the roof. I know that a lot of the dispensaries, Curaleaf in particular, really transitioned to being like curbside pickup. You could order. And I love that it was deemed essential. And I still think that cannabis is going to remain an essential product because now we're coming out of a post-pandemic, and there was a lot of trauma in this pandemic. A lot of mental health was strained. One of us said it about being at home with your kids all day long.
So
Let me lean in. All day long.
Yeah.
all day.
So I actually have some stats on this because Curaleaf partnered with Harris Poll and did a whole survey about cannabis use during COVID-19, right, which I think is so fascinating. And what they came out with of the poll is that 42% of adults over 21 started or increased their cannabis consumption post-COVID. And this is the statistic I love the most. 45% had reduced or replaced alcohol with cannabis. And I think that, there's two reasons for that. Like, one, COVID gave people so much more time and resources to be able to research cannabis, what's available to them, find a doctor, make the telemedicine appointment, like all the things they probably were putting off when they were busy outside and doing a bunch of stuff. They all of a sudden had this time on their hands. But I also think, when you're in a health pandemic, you start taking a look at your lifestyle and you're like, I could do better. I could be healthier. I am putting myself at risk if I get COVID, if I do X, Y, Z. And so let me, adopt a healthier lifestyle. Let me reduce my alcohol, especially after like the first 3 months of COVID when everyone was over consuming alcohol. It was like, okay, maybe this is a bad idea. Like, what can I do that's different? And it's like, oh, cannabis. And then it's like, well, oh my gosh, I can use this and wake up the next morning and I feel great. Like, that's awesome. And so it really, I think, allowed people the time to educate themselves and try different things. The essential was so huge for us. It was like so legitimizing to be recognized as an essential service. And I was proud. I was proud to go to the dispensary every day. I was also happy not to be stuck at home with my husband, to be completely honest. I'm like, get me out of my house. I'm, serving the greater good. I'm making people feel better in the midst of a pandemic. And that was really awesome.
Wow. I mean, I know what's going to happen as we come out of this. It's still going to be essential because it's been essential for a lot of us for a long, long time. And I love that people that have decided the conversations are going to shift, I feel, as a result of there being more patients and more people are looking to cannabis for their health. I think that is going to be a really great shift. So, so my last one, and then I want you to just kind of give us like what you would tell a parent, a mom, on what she should do to advocate for her health. But I wanted to really just touch on the parenting aspect. When you're having, like, I have a 14-year-old child, teenager, and he is obviously lucky because I've been doing this work professionally for close to 6 years. So he's been to more Women Grow events than most people. And we can have conversations about cannabis. And I know one of the big issues for the moms that I know is, how do I talk to my kids? I don't want my kids thinking that it's okay for them because I've made that decision, to use it for myself. And what kind of conversations what would you tell a mom who has really like fighting with her consumption or her achieving her overall health because she really just doesn't want to be a bad influence, or kind of like not be that do what I say, not what I do mom? What would you tell her? Dr. Stacia.
I'm the only non-mom. You're picking me first. So I think honesty is important and proper education is important, right? We're not afraid to talk to our kids about alcohol and why it's not a good idea for them to drink prior to a certain age. And I think that we should be talking about cannabis use with that same lens, and prescription drugs, right? Like there's not this feeling of I have to hide my prescription drugs from my child, right? It's medicine that you take for a condition. And I think that cannabis is no different. I think it's important, for children to understand that it can affect their brain growth and development in a way that could be potentially harmful. And that's why it's, unless there's a medical condition that warrants it, it's not something that they should be using recreationally until they're older. But I really just think honesty and open, proper education goes a lot farther than just say no. Because what just say no does is
makes them want to say yes.
Want to try it. Yeah.
Exactly.
And particularly with cannabis, it's been put in the same pile as heroin and cocaine and all of these other illicit substances. And usually it's the first thing that, teenagers will try. And they're like, well, if they've been telling me about cannabis that it's so bad and I tried it and it's really no big deal, then surely these other things are equally as safe. And that's not the case at all. And so that's where honest, proper education, I think, comes into play, why things are different, why, how addiction happens, all of those things. Plays a big role. I mean, alcoholism runs rampantly in my family. And so from a very young age, my parents were very open with us about that and told us about responsible alcohol use and that we needed to be very careful because it ran in our family. And we had a really open conversation. It made us all very responsible, mindful adults when it came to consuming alcohol. And I think that can apply to a lot of things, not just cannabis, but we need to not be afraid to have those conversations.
Absolutely. Dr. Chin, you have these conversations with your young people, because you work in this space, but what about someone who's new to cannabis or really just battling having that conversation with their child?
Yeah, I agree wholeheartedly with what Dr. Stacia said. But what's interesting, and I don't want to repeat what she said, but during this pandemic, I've had a lot of moms call me to sort of be the MD liaison because they find out that their adolescent child is smoking cannabis a lot on their own, and they want some sort of help, and then the child might say, well, mom, you use cannabis, dad, you use cannabis, why can't I use cannabis? Or even college kids that have been at home and not in their campus. The parents will call me and say, oh my God, they're smoking so much weed. What's happening? What do we do now? So I always begin the conversation, if there's a psychiatrist involved or a psychologist, we could loop them in. But I always begin the conversation was, why are you using cannabis? This is for the teenager or for the college young adult. And we talk about, if you're using it for therapeutic, how can we make it so that you can use it safely? Or how can we make it so that we are adding cognitive behavioral therapy? We're adding other supportive measures if you're a teenager and you should not be using it. But I always, the thing about that teenage use, and I had this conversation actually with the PTA here in Westchester. If you're a teenager and you're having terrible anxiety, terrible ADHD, you're having terrible depression, and you're using cannabis and it helps you, right? You're not a normal functioning teenager. So we have to look at that, and we have to get you a card, and we have to be able to help you create a game plan on how to use cannabinoids. Now, this doesn't mean just THC. How to use cannabinoids to help you balance your body. And maybe there will be prescription medications. And if your parents are using it, if mom is using it, there's that open discussion of how am I taking charge of my health and using this therapeutically. So it's really having an open conversation and putting everything on the table so that you're discussing it. Because when you don't discuss it and you find the bong in your kid's bedroom, that's when you get into issues. That's when there's mistrust and communication issues.
Absolutely. Wow, that was great. That was great. Tianna, what about you? When you had the conversation with your young ones, how did that go?
I mean, I agree with all the things, right? Everything that both Dr. Stacia and Dr. June are saying. When it comes to my children, I mean, they're what, 12, 10, and 8. They were maybe about 5 years ago. So they already had the understanding that mommy and daddy like use this for medicine or whatever. But we also try to push past that, like on another level, and really educate them on why there's a stigma in the first place, right? Like, let's break down the fact that because of racism, it's illegal. Let's talk about prohibition. So they know that there's something really weird about the fact that if mommy or daddy or Uncle Joe Blow, whatever his name, gets caught with medicinal cannabis in one state, but you can walk 5 minutes across the state line and you're fine. There's a real problem with that.
Yes.
So I think that is something that all parents, if they're having a conversation with their kids, show that side as well, because these kids, this generation is a generation of bravery. They want change, and they're not afraid to stand up and be like, oh, hell no. Like, this is not right. I feel like, God forbid, if something ever were to happen with me legally, I would have advocates in my corner. But I also know that my kids would be right there and being like, my mother is a better mother and she's alive because of this. But on top of that, I think it's just, still being mindful of the stigma, because, you don't want to go around like your parents are stoned or they're, whatever it is, because they see that on social media, and my kid, like, they have questions about it. And I have told my kids plenty of times, and I will stick by this. If there's a point in their life where they feel pressured by a friend or whatever, since they know that this is something that mommy and daddy feel passionate about, please come to us first, because people could be lacing your stuff with whatever it is. I would rather you have this opportunity with me first than someone that I don't know. And once you are 21 or whatever, and you choose to do it your way, make sure that you're doing it the right way to stay safe. So really, we just try to keep it funky.
I agree with that 100%. In fact, my son didn't even know. He was having a conversation with one of his friends, and he comes to me after their chat, and he was like, is weed cannabis? And I'm like, yeah. He was like, oh, okay, because I thought that they were talking about it, but I wasn't really sure, because we don't call it that. You know what I mean? We say cannabis. Yeah. So and then we have conversations, and I think it is so huge, especially what Dr. June said, is I had an experience at Women Grow with a teacher came up to me and said, I need you to come to the school. The kids are smoking. And I'm like, okay, well, when they're smoking, what do you do?
Yeah.
And she said, brace yourselves. We call the police. And I was like, okay. And this is an inner city school, which raises a whole other set of challenges, as we know. And I said, did anybody ever ask the young person why? Why did you feel you needed or wanted to smoke? No. I mean, we could teach a 3-year-old Mandarin, right? But we can't teach a teenager cannabis. I think that we're doing our young people a disservice by thinking that they can't get it. But we all know stigma is real, right? So we have our own stigmas. And New York legalized cannabis this year. Thank you, whoever you pray to. And I think a big thing for a lot of the moms that I know was that now CPS isn't going to show up at their door anymore. You know what I mean? I know 4 women in our community that CPS has showed up at their house and knock on wood that they were all medical patients, but I was fearful that they weren't, and that they didn't have their cards, and that would have been a big challenge. So I understand the stigma, but we do have to educate our kids because we don't want to repeat problems. You know, educated kids, educated young people really do change. Kids are different now. We get a 16-year-old trying to change the climate of the world, you know, so we need to give our kids a little bit more credit for understanding that this is medicine and it's not what they think it is. You know what I mean? So I want us to wrap up. I think we've had, let's see if there's any questions in the chat. I wanted to do that beforehand.
In the chat, there was someone who asked a question that I actually was going to throw in here too, when we're talking about having the conversation about mothers. What about breastfeeding mothers? And maybe that's a question for the doctors. Yeah, like mothers who are breastfeeding, you know, like how does that?
That's the hot topic lately. That's the hot topic.
2020. There's a lot of y'all out there.
Yes. Dr. June, do you have any input on nursing moms?
You know, I always look to that study, that Jamaica study that was done, you know, longitudinally, and it's significant for me because I suffered from postpartum depression. I didn't use cannabis at the time. I wish I did, you know, because I think that disconnect from your child and even from your own body after going through such freaking trauma. I mean, you know, your whole insides are turned out. All that pain. I mean, a little bit of cannabis goes a long way.
I agree.
You know, so I say weigh the pros and cons. You know, when you're breastfeeding, maybe space it apart, just like you would if you decided to have that glass of wine. You know, you could pump and dump.
I was just gonna say,
you know,
I was gonna Dr. Stacia, are people asking these questions when you see them at dispensary?
Yeah, absolutely. And I think with pregnancy and breastfeeding, just like with any prescription medication, it's risk versus benefit. You have to look at the risk to the baby versus the benefit to the mom, and vice versa, right? So if you have someone that has significant pain or, you know, whatever it is that they're using cannabis for, and they aren't able to breastfeed or be a successful mother without it, you know, that's worth it, right? So you can't just paint everything with the same brush and say absolutely not or absolutely yes, right? Just like anything, there's shades of gray. And that's where I think it's really important to talk to a knowledgeable clinician to make an educated decision instead of just deciding that it must just be fine, right? Do the work, do the due diligence, and really assess whether it's worth it or not in your individual situation.
Yeah, and I had a mom actually that smoked too much cannabis. And I confronted her and I said, listen, you know, your partner is saying that you're not holding the baby, you're not breastfeeding, you know, you're smoking a lot of cannabis. There's got to be something else going on. And come to find out, she wasn't taking her anti-psych meds. She had bipolar. She stopped taking all her meds. And she's, you know, it was really something else. It wasn't the cannabis, but she was trying to make it up with the cannabis. As soon as she got back on her medication, she was able to temper on the cannabis and she was, you know, way better. So just digging in a little bit deeper and figuring out, again, you know, what's going on here.
Right. It's great when you say that, but also a lot of doctors don't want to do the dig.
Yeah, that is so true. I'm like,
I mean, you said use 7 minutes. I'm in a doctor's office quicker than I'm in a dressing room at a mall. You know, I mean, they don't want to do the dig. So you do have to, again, back to self-advocacy, find a doctor who is willing and able to do that dig for you because it's so important. Thank you. Tianna, did you want to say something? I saw that you were.
They said, I was just saying 3 was my number. At my third child, I was like, oh, okay, we're just going to have to cannabis.
Listen, I am one and done. And I was like.
Listen, just the thought of having one and I'm.
So, yeah.
There was another question that I thought was great. Oh, there we go. What do you say to parents about using CBD for their kids for ADD? Do you suggest a medical card because of its use of CBD with minors?
Yes, I think you can use CBD for children for ADD. I don't think you need a medical card. There's some really great hemp CBD products out there that you can use. And you could always contact me directly and I can give you some guidance around that.
Just make sure that they're regulated, tested hemp CBD products, and please don't buy them on Amazon.
Right.
Or the gas station. Who's buying CBD in the gas station? But in any event, yes, we can use. My son, when he was little, he had some scoliosis. Like he had literal growing pains, and CBD really, really helped him. But I couldn't, and this is a side note, as a woman of color, I told my son not to say anything because I was fearful of if he was in school, an unknowledgeable teacher could say, he's like, oh, I took CBD this morning. And they're like, oh my God, he's in school stoned. And I just didn't want to have that conversation. So just sometimes a medical card, I mean, I'm not plugging cards, but sometimes a medical card for that extra level of medical protection, sometimes it helps, And
yeah, but ADD doesn't qualify as a medical for a minor.
That's right, it doesn't. Oh, we have so much work to do.
Well, with the new regs, it will, because it's any qualifying condition. So we just need to get them implemented.
Absolutely. Is CBD or cannabis good for hyper young adults? Oh, let me put it here. Is good for hyper young adults who may also have depression at times?
Yes. I'm sorry. That's my mother. Maybe I'm myself now.
What do you, that is a question. Is cannabis good for hyper young adults, or is CBD or cannabis good for that?
I think you would need a more in-depth clinical evaluation to figure out exactly what's going on. What we keep saying this over and over, but possibly. I think you would need to be evaluated, figure out exactly what's going on, what other medications there are, if there are other factors involved before just saying, sure, go try it. Like it's more complex than that, I think.
Yes, we need to work with medical professionals who can look at the full picture of things. And I think that's the most important, because when you were mentioning, both of you were mentioning things about, well, we should look at this and we should look at that and we should look at this to really make a complete picture, to be our most holistic. Oh, look at me, holistic. That's really what we need, is to get to that point where our medical care and our wellness is in exactly that. We're encompassing our mental wellness, our physical wellness, and our emotional wellness, all of the above. I want to thank you all so much. This was so much fun. I know, because a lot of you haven't seen it in a really long time.
Yes, it always is. Thank you.
I want to thank our sponsors, Curaleaf, for supporting this event. So please, as we wrap up, can you please just, I'll start with Tianna. What would you tell a mom? Give some words of encouragement for moms out there, moms wanting to use cannabis, the curious, what have you.
Okay, so I would show them this. I got this from a friend of mine. She was actually a Women Grow producer when we were out here in Atlanta, Keosha, and she has her own little collective for merch. And she did one of these. It's can you see it says "Good Mom Smoke Weed Too"?
Oh yeah.
Right. So it's sitting right on my Mac, and my daughter, my 8-year-old, she also has a sticker that's on her wall. Like she just took one, and every time I walk in there, it's just a constant reminder that I'm okay. Right? We're doing a good job. So to all the parents out there, be your true self, be true to yourself, be true to your children. And that intuition is going to kick in. Just trust the process and do your research. Don't be afraid to reach out to people like us, advocates, and advocate for yourself. You got this.
Thank you so much, Tianna. I appreciate you. Dr. June, want to chime in?
I echo that. I think
little mama there.
Yeah, as a mother and a physician, seeing both sides, I think women have really incredible intuition. And if you think you have a gut issue, but your GI doctor said no, it's not a gut issue, I checked everything out, you just have to keep digging and find another physician, because normally I would say of all my patients that I see after they've seen tons of other specialists, they end up being right. They're like, it's a nerve issue. I know it's, behind my knee, and all the MRIs and the CTs are negative and the labs are negative. Eventually it does show up. They just knew it sooner.
Wow. Yeah. Follow your intuition, right?
Yep.
That's amazing. Dr. Stacia?
You're not alone. I think it's important to know that there are other people like you, whether you're curious, whether you're using cannabis, whether you're interested. I think there are groups like Women Grow that will support you and help you on your journey, and there are clinicians that will support you. So don't be afraid to utilize the resources that are out there and to advocate for yourself. Continue to ask questions, to continue to learn, continue to explore what's available to you. We're women, we're strong, but we often don't prioritize ourselves. So make sure that you take time to do that too. It's very important.
Absolutely. They say when you're on the plane that you have to put your oxygen on first so that you could save everybody else. And if moms aren't healthy and well, we can't take care of the people that we love and care about the most. So It is so important. Again, everyone out there, thank you so much for joining us today. You know how to find us. We are Women Grow. We are Women Grow on every platform. Thanks again. Thank you for Curaleaf again for supporting this event. And everyone have a great rest of your week. And
Happy Memorial Day weekend.
Let's enjoy it. Dr. June, thank you. Dr. Stacia, thank you. Tianna, thank you. Everyone have a great rest of your week. And we are done for the day. Thank you.
Thanks, everyone.
Bye.
Bye.